Hello friends, how are you? Hope you have seen my previous two videos. So this is third video in ECG lecture series. In first video I have discussed about the what is normal in the ECG strip. After we knowing normal things, we can move towards the abnormal things. In second my series video I have discussed about the P wave. In this today third series I will discuss about the PR segment. I hope after watching my first video you know what is PR segment. This is P, this is Q, R, S, T. This is beginning of P wave to the beginning of QRS complex. You know P wave is atrial depolarization and Q wave and at QRS complex is ventricular depolarization. The time duration. I hope you remember the time duration. The time normal is zero point 0.2 to 0.20 seconds. If the time duration is less than zero point 0.2 second, then there will be a short PR interval. If time duration is more than, then there is a increased PR interval. So both the condition have disease. So we are going in a flowchart manner. You can see the disease of short PR interval and long PR interval. We say long PR interval is more than 0.20 second. Okay, 0.20 second, or if you want to remember in a simpler way, more than 5 small squares. Short PR interval is less than 0.12 second means or less 3 small squares. Okay, we are discussing about the PR interval. The time duration is most important, and what you will see, there is a short PR interval. The conditions like WPW syndrome. What is Wolff's Parkinson White syndrome? Another Louis Gannon Levin syndrome. Gannon Levin syndrome. Third, that may be retrograde junctional P wave. Short pair interval. Another, if there is a more than 20 second, the duration of PR interval is more than this, then there can be a heart blocks. The most important we encounter in our discussion with our friends or colleagues, we most commonly heard heart blocks. They can be first degree heart block, second degree heart block. Second degree also have two types, morbids 1, morbids 2, then third degree heart block. So in today's lecture 3 series I will discuss about the increased duration of PR interval. So I will discuss in very simpler manner. After listening to me or watching this video, if you appreciate ECG strip, or you will google any ECG online, or if you are having an ECG, it will be very easier for you to recognize this abnormalities. Please google it down after watching my video. You will be very comfortable. Duration is more than 20 second. What will happen in the primary heart block or first degree heart block? There will be constant in this, you can see constant it's increase. This is for suppose this is 0.4, then again this wave QRS, the duration is 0.24. The PR interval, the constant, this T wave. Hope you are understanding what I'm saying, that there is constant more than 0.2. Please don't go through this diagram. What I want to say that there is a, in first degree heart block, there is increase in PR interval more than 20 second, and this will be constant throughout the ECG strips. It remains constant from beat to beat. If you found one place there is a 0.24 PR interval, in other beat also you will find 0.24 of PR interval. The duration remains constant. Okay, the first, in easier terms you can say there is a prolongation of PR interval, but there is a fixed. If there is a PR interval is 0.24, it will always remain 0.24 in this. Okay, now number two, this two second degree heart block. In second degree heart block, what we will say, there are also a two types, Mobitz 1 and Mobitz 2nd. Mobitz 1 is also known as Van Beck's phenomena. In this there is a progressive lengthening of PR interval. Progressive interval following followed by a drop beat. Hope you understand in simpler language. In second degree block there is a progressive Mobitz 1 progressive lengthening of PR interval followed by a drop beat. What you appreciated in type 1, there is an increase in PR interval but the time duration will remain same, that is 0.24 or you can say 0.26, whatever it always remain constant in first degree. But in second degree block, in Van Beck's phenomena, there is a progressive increase in 0.24 the PR interval, another PR interval is 0.26, then point this, okay, remove this one, 0.26, 0.28, and then there is a no beat, no PR interval, you cannot see the PR interval. So this is a theoretical progressive lengthening of PR interval followed by a drop beat. Understood? Now we are going towards the type 2 block. It's a very simpler word. If you listen this video and go to the ECG strip, you will understand. Just go lay down, Google the ECG and you will find out. Type second is another is Mobitz. No progressive lengthening of PR interval followed by a drop beat. Okay, understood? There will if you find something like 0.26 of PR interval, 0.26, and then you will find a drop beat. It's kinda type 1 also, similar as type 1 degree first degree block. In first degree block the difference is you won't find a missed beat. In second Mobitz you will see a drop or missed beat. I hope you understood the type 2 also. Moving towards the type 3 or third degree heart block. In third degree heart block there is a P wave has no relation with or to QRS complex. It always has more P waves than QRS complex. Understood? More PR wave. This you can say this P, Q, R, S, then again P, Q, R, S, T, and again you will have P wave, P wave. There is a doubling of P wave, then QRS. Means there is no relation of P wave and QR waves. The n number of times P wave can there be n number of times of Q waves. Understood? After knowing this a basic thing, you can appreciate very easily about the ECG changes in the third degree heart block. And if you say, just for the sake of understanding, the clinical features will be: patient will have blackout or sudden loss of consciousness or syncope, or B, another feature may be there is usually a pulse always be less than 40 beats per minute. The reason, I'm not going towards the mechanism, I'm giving you just pinpoint, just bullet points, so that you can remember easily, and you will not sound dumb whenever we see the ECG. I used to be, whenever I see the ECG strips, I feel like that, I don't know anything. But if you know the basic things, this thing, the difference between first degree, second degree, and third degree heart block, it's very easily. The mechanism is, there is a no relation between the conductions from SA nodes to AV nodes. SA, you know the conduction pathway, SA node, AV node, bundle of is, there is a no relation to this. So that's why P wave is going to a different, Q wave are different. So this is the third difference between. So I have discussed in this video about the about the PR interval are two types: short PR interval or long PR interval. I have discussed the disease about type 1, type 2, type 3. Type 2 also hai morbid's type 2. Okay, hope the bullet points you can remember, and you can go through a ECG strips, and you will easily you can appreciate. Thank you for watching. In next video I will discuss about the short PR interval in next video. Thank you so much for watching.